Hello, everybody. This is the meeting regarding employee benefits for Aker Kasten Home Healthcare. This is Matthew from Aker Kasten. Hope you're all doing well. I'm online with Debbie today from CGI, who is a godsend for us. Debbie and Colleen and Jamie and the team there are on our team helping us get the best benefits for you. And I'll mention it again, and I know Debbie will later too, that they are superstars as far as answering questions about details. I teasingly will say to many of you through the year that if you call me asking for specifics on the plan, I really don't know anything about it. I will quickly push you on to Debbie and Colleen. So their contact information will be available, and you'll hear from Debbie in a little bit. But just appreciate them and the work they do for us. And for you employees of ours, we appreciate you. We appreciate the fact that you've been faithful and working consistently with us through this year, and being that you're listening to this, it's telling us that you are eligible for our benefits plan. So for you who have been here with the company for years, you know that we wanted to give benefits to employees long before we were required by law to provide benefits for our employees. So this is something that is important to us. It's important for us to get plans that are affordable, that are helpful, that are bringing you benefits, whether it's in the medical, dental, vision, or other supplemental areas. We're trying to do things to encourage you and to provide for you in ways that are beyond even what is minimal. So hopefully you can appreciate that as we go through the plans today. Also, as years go by and plans change and providers change, we're trying to narrow in on the plans that work best for you as an employee of ours. So be patient with us as we kind of tweak the system going forward. Just know that our heart is in a place of wanting to provide benefit for you. So be aware of that as you're listening to the plans even today for this year. Eligibility is an important thing. We talk about it when we hire you. Eligibility for insurance is proof that you have been working full-time or considered full-time for us for the last 12-month period. If you remember, full-time, the equivalent is, for us, 130 hours of work on average a month for the course of the 12 months. So some of you have been being watched for 12 months. Some of you are continuing eligibility based on your faithfulness with us. But that 130 hours a month is an important thing to remember, not just initially for eligibility, but also for continued eligibility. And I just want to highlight a couple things about that, just so you're aware of it going into the insurance plan for this year, that if you are eligible, that doesn't mean you're eligible forever. You need to continue working so that you can maintain that eligibility status. I've had the tough conversations with caregivers in the past who were eligible, but because of their inconsistent work in a given year or period for whatever reason, they lost their eligibility and therefore lost their insurance coverage. So just be aware of that. If you're eligible, it's because you've been consistent at work, and we want you to continue to be consistent at work going forward as an active employee of Aker Kasten. Remember too that you are active with us as long as you're taking hours for a 30-hour period, or 30-day period, excuse me. So if you at any point take a 30-day break, we consider you inactive with us, and we will end your insurance at the end of that calendar month. So very rarely will a caregiver not be offered plans or offered jobs after they come off of the shift. So if your case ends, we're going to try to reach out to you and get you on a case as quickly as possible. And if you're on the insurance and you want to continue on insurance, it's helpful for you to pick up those hours so that you can maintain active status with us. Remember too that your premiums are going to be coming out of your paycheck. And for some of the premiums, they carry a pre-tax benefit. So you want to be aware of that as you are going forward. If you are out of work, your premiums are still due. So this has been one area that I've been trying to figure out how to manage a little bit more effectively even this last year. When a caregiver is on the benefit plan and they're out of work, those premiums are going to be due from you out of pocket. So this year we're going to change our policy a little bit, in that if you come on the insurance plan, I'm going to collect either a credit card or a debit card from you so that if a premium is missed, then that will be processed through a credit card or a debit card, rather than waiting and trying to go back and forth in invoices and things. I think it's just going to clear the system up a little bit. If you have questions about that, I will be available to answer the questions. If you are signing up for the insurance and I see you're going live with insurance, I'll reach out to you about the credit card and debit card. The last thing I wanted to mention, again, I mentioned it briefly just a second ago, but that 30 days of inactive work is an important time period to remember. So if you come off of a case and you're not working for more than 30 days, we consider you inactive with regards to benefits. So at the end of that calendar month, your insurance will end. I will be notifying you, or Natalie in our office will be notifying you as to that deadline for that. So just be aware of that. It's not because we don't like you, it's because we want to provide care for workers that are continuing to work with us. So let's work together to keep that benefit going for you. There is a timeline as we open up enrollment for insurance. There is a time period that you need to sign up. The dates and the deadlines will be communicated through an email that I'll send with this video and with other supplemental information. So be aware of those deadlines. They're important because if you miss a deadline, you miss the opportunity to sign up. So I encourage you to take advantage of that. And then last thing, again, where I started, just special thanks goes to CGI, for Debbie and for Colleen, for Jamie and the whole team there at CGI. They do a fantastic work in supporting what we do. And they are always available for questions, and they are always fast at getting back with answers. So I encourage you to memorize their number, put it in your phone, so that you can call them and get help from them. But I think I covered everything I needed to. With that, I hand it over to Debbie, who works with CGI. She's our broker, so she is on our side helping us get the benefits and maintain the benefits that we've agreed to. So I hand it off to Debbie to explain what is on the table for benefits for this coming year.
Hi, thank you, Matthew. That was a very nice introduction. Again, Matthew said, my name is Debbie Rito. I do work for CGI, and I work with you. I've probably spoken to a lot of the employees at Aker Kasten, so nice to speak with you again. As Matthew stated, we are going to go through our benefits at a glance at a high level. We wanted to remind you that benefits that you enroll in are going to begin on May 1st, 2022, and they will go in effect through April 30th, 2023. The only time that you can make a change after May 1st is if you had a qualifying event, and you only have 30 days to notify us of your event, and you will have to provide supporting documentation to that. A qualifying event is a marriage, a divorce, a birth or adoption, death of a spouse, death of a dependent, loss of a dependent status, or loss of spouse's job where coverage was maintained through their plan. The first page of the benefit at a glance, we included information on how to search for a provider for medical, dental, and vision. We also included what the medical dependent age for both medical, dental, and vision. On page 2, we're going to go over the benefits. You were being offered 4 Aetna plans. 3 of the Aetna plans are brand new, and 1 is a plan that was offered last year, which will be the first plan, the OAEPO 7200. Please keep in mind that all 4 plans use the same network. All 4 plans offer you a primary and specialist, as well as an urgent care copay. You also have 0 copay for the CVS Minute Clinic and 0 copay for preventative care. I wanted to remind you guys what a copay is. Remember, it's a fixed amount that you would pay for a covered healthcare service, usually when you receive the service. The amount may vary depending on the type of covered service. So as in the first plan, you could see a primary care is $35 and a specialist is $100. A deductible, just as a reminder, is the amount you owe for healthcare services your health insurance covers before your health insurance begins to pay, which means it's the first dollar that you would owe before the carrier would then share in the cost. A co-insurance is a shared amount that you agreed to pay. Out-of-pocket maximums are the most you will pay during a calendar year not including your payroll deductions. All 4 plans offer you RX coverage. All 4 plans also have $10 copay for generic. Please keep in mind the first 2 plans have deductible coverage that needs to be met. So you would have to meet your calendar year deductible, then a copay for brand, non-preferred, and specialty drugs. The last 2 plans have a separate RX deductible that will need to be met when you use preferred brand, non-preferred, and specialty drugs. Please keep in mind that all copay, coinsurance, and deductibles go to your out-of-pocket maximums. RX. We included this information on here just to remind people that you have the ability to go to Walmart, Winn-Dixie. Some of our grocery stores that have pharmacies have lower cost prescription drugs. You wouldn't even give them your insurance card. You would just have to ask them, is the prescription that you're looking to fill is on their formulary. It could be at $4 as opposed to paying even the $10 generic drugs. So we wanted to remind you that, it's important to advocate for yourself. You would never even give them your insurance card. GoodRx also is a good resource for discount on prescription drugs as well. Aetna, we encourage everybody that enrolls in the benefits to definitely log into the Aetna member website. There is a wealth of information that can be found on the website, such as your in-net providers, your managing claims. You can see coverage and costs, managing prescriptions. It can help you with members staying healthy, as well as accessing your digital ID card so that you can always save it in your photos and it's always available to you all the time. Minute clinics, as I discussed earlier, that they are at a no-cost share. Minute clinics can offer you, they're open 7 days a week. They have a broad range of services that treat and diagnose a variety of illnesses, injuries, and conditions. You can pick up your prescriptions on site as well. Aetna also still has a program that's through Attain. You would download the app and you can earn gift cards. You can earn rewards towards paying for an Apple Watch. You just have to log on, follow the app and instructions. You can also find on Employee Navigator the additional information on the Attain watch and what is needed to move forward through that. Dental, you will have 2 choices to choose from. The DHMO, please keep in mind that you must pick a provider. There is no calendar out-of-pocket maximum. There's no yearly deductible. And you know exactly what it costs you for copay going to see that service. So you have 2 cleanings per year in a 12-month calendar year. You can find the fee schedule on Employee Navigator as well as your member portal through guardianlife.com. The PPO offers you in and out of network benefits. There is a $1,000 rollover maximum as well as a calendar year maximum. You get 2 cleanings for as well, but it's 1 every 6 months. You do have a deductible and co-insurance for other services. There is no orthodontia on the PPO plan, but you do have orthodontia benefits for both child and adult on the DHMO. Each plan uses a different network, so when you log on to find your provider, you're going to use the Managed Care Dental for DHMO and the PPO network for PPO. If you are enrolled in the dental, you have the ability to enroll also in a college tuition benefit. For every dollar that you spend for your dental, it turns into reward points, which eventually turns into tuition dollars. You can find additional information on Employee Navigator under helpful resources, as well as logging into College Tuition's network. We've included that information on their website. Accident. The accident insurance is an extra layer of protection that pays you cash when you suffer an unexpected qualifying accident. It provides you money to cover any extra out-of-pocket expenses associated with an injury. Accident insurance can pay you a lump sum in cash after you suffer an accident like a severe burn or a broken bone or emergency room visit. The benefit policy does offer a special benefit that pays for children injured while playing an organized sport like soccer, baseball, lacrosse, or football. Additional information can be found on Employee Navigator under the Helpful Resource tab, where you'll be able to see the additional benefits. These here are just being highlighted just as a few benefits that you could have with the accident. It does also give you a $50 wellness visit, as well as a death benefit of $25,000 for an employee, $12,500 for a spouse, and $5,000 for a child who is enrolled. Remember that all you need is your explanation of benefits, a claim form. You would submit it directly to Guardian and they would reimburse you. How will you choose to spend the money is totally up to you. Vision. The network we'll be using is Davis Vision. You have copays to have an eye exam. You have a copay, you have co-insurance and a allowable amount for frames and contact lenses. You cannot choose frames and contact lenses in the same year, so you can alternate. If you decide to have frames done this year, maybe next year you can do contact lenses. Remember, examinations are every 12 months. Contact lenses can be done every 12 months, and frames are every 24 months. There are in and out of network benefits, but as you can see, the out of network benefits allowance is very low. If you use VisionWorks, they do give you an extra $50 allowance towards the frames. Critical illness. Critical illness insurance helps you cover medical expenses that your primary health insurance won't. It's a cash payout you would receive if ever you had a serious illness like a cancer or stroke. Critical illness is a good supplemental option for people who already have health insurance because it gives you additional money to pay for expenses like deductibles. Critical illness includes stroke, heart attacks, cancer, and more. There's about 30 major illnesses that are being covered. You can find that additional information as well on Employee Navigator under the Helpful Resources. Employee can enroll in a $10,000 benefit. A spouse can have 50% of the employee, and children at $2,500. Employees' premium that is covered for the child. If you would like to enroll your children in the critical illness, you just need to elect the benefit, and the premium is included with the employees. Employee Assistance Program. Employee Assistance Program is offered to you at no cost. You get 3 face-to-face meetings. It's completely anonymous. EAPs can assist with personal problems, on and off related problems that could impact your well-being. Basic life with accidental death and dismemberment. Aker Kasten is offering all eligible employees a $15,000 as well as accidental death and dismemberment life insurance policy at no cost to you. When you go through Employee Navigator and enroll, you want to be sure to make sure you elect your beneficiaries so that in the event that something should happen to you, your beneficiary will be able to get the benefit. We discussed that Employee Navigator is how we will be enrolling in our benefits. If you are a first-time user, you will select Register as a new user, create a username. You will need to provide your first name, last name, and company identifier. It is case sensitive, so you want to enter it exactly how it is shown. You will need to provide the last 4 digits of your social and your date of birth, how it is shown. 2 digits for the month, 2 digits for the day, and 4 digits for the year. You will select Next, create your username, and agree to the terms. We do suggest that everybody use their work email as a username. We don't have access to anybody's passwords, but we can definitely help with usernames. If you're a returning user, go to employeenavigator.com, enter your username and password. Again, if you forgot your password, you would just click on the link that says reset a forgotten password, and a link will be emailed to you. All eligible employees must enroll or decline their benefits. You will know that you have completed your enrollment when you get to the enrollment summary page and you click here to sign, and it will give you an acknowledge to submit, and that will give you your payroll deductions. If you have any questions, again, my name is Debbie Rito, or Colleen is my colleague who works with me, and you can give us a call. We're happy to answer any questions that you have about your benefits. If you're having questions or problems in logging on, I'd be happy to help you with that as well. We also included contact information for the medical, dental, vision, accident, critical illness, and life insurance, the contact phone number for college tuition, as well as the EAP. Matthew, do you have anything that you want to add, or did you have any comments that you wanted me to touch on or go back over in the benefits?
I think I appreciate your just overview. I think it brought out some of the pieces that a lot of times the caregivers have questions for. Obviously, insurance policies are specific and they're complex, so you want to go through them and make sure that you really understand the benefits that is there on each policy. So if you have questions as you're looking through that benefits at a glance guide, don't hesitate to call and get those answers before you sign up. I did want to come back to a couple points on the apps and the websites. The Employee Navigator website is a website that we use a lot in the office. There is an application on your phone. I think it's both. Debbie, is it both Android and iPhone that you can get the Employee Navigator app? But I would encourage you to download that app or log on online so that you can sign up for all the benefits. The one piece of the sign-up process that we sometimes miss is, even if you are declining coverage, you still need to go on, log in, and decline coverage so that we know that you're declining and the reason for your declining. And then also with that life insurance policy that we are buying for you as an employee of Aker Kasten, you want to make sure you put down the beneficiaries. If there's no beneficiary listed, it goes to the general estate of the employee, and that's a little bit more challenging to get to if there's an incident where that's called upon. The other app I want to bring up, just again, the Aetna app is really helpful, and the Apple Watch benefit is really awesome. So I would encourage you to look into that. The what's it called? The Attain app is really fun. I'm up to, I think, almost 120,000 points. So that's about 120
Wow.
bucks in cash to whatever I got. So I encourage you to do that, and it's just fun. It gives you fun little tips and tricks and habits to form and those types of things. So I encourage you to jump on. And the last thing, and then we'll wrap up, is that employee assistance program. I think a lot of employees don't realize that that is there. And if you look at the list of specific benefits in that plan, or that program rather, there's some really helpful services with education, dependent care, lifestyle and fitness, and legal and financial. I know all of us go through different times of challenges or planning or those types of things. And that employee assistance program is for you as an employee of Aker Kasten. So I wouldn't jump past that section because there's some helpful resources in there. But that's all I wanted to add, Debbie. So
now, and I agree with you on the
Yeah.
Yes, I agree with you, Matthew, on the EAP. I know I went through things kind of quickly. All the benefits summaries are listed on Employee Navigator, so they're always there for you. But the EAP is definitely a wonderful benefit. It is confidential. Your employer will never know if you use the benefit or you don't use the benefit. So a lot of people get worried about that when they call in. It's completely confidential. It's there for you because Aker Kasten cares about the well-being of their employees.
Yeah, thanks, Debbie. No, I think you did a fantastic job. I appreciate the summary.
Well, that being said, I want to thank you all for attending the Benefits at a Glance. But remember, benefits begin May 1st, 2022, and they go through April 30th, 2023. I want to thank you for listening in, and I hope you all have a wonderful day. Thank you.